So we're live on Kids OK Please again. Hello and welcome. Kids OK Please is an evolving privilege ecosystem that brings all childhood-worthy experiences, deals, and venues on human fingertips through the intuitive use of technology. Today is our Kids OK Please live session where we're going to have Dr. Sagar Abichandani. We're just waiting for Sir to join in, and meanwhile, letting you know what Kids OK Please Live is. Kids OK Please Live is a medium to establish and to uncover the intel and insights about the ecosystem where parents and children occupy, the ecosystem that parents and children occupy in our business, society, and lives. Also to inform you, Kids OK Please is coming up with memberships for all those parents who have lovely children and to keep them busy with amazing offers. So stay tuned. We're going to have some amazing memberships come in. We're just waiting for our guest. Okay. We're just waiting for our guest to connect. Hello, sir. How are you?
I'm good. How are you?
Great,
Good to
great.
see you.
Good to see you too, sir. So, giving you an introduction, we'll start with your introduction. Very, very happy and glad to have you on this platform.
My pleasure.
So today, for everyone who's viewing, our guest is Dr. Sagar Abichandani. Sir, I hope I spelled that correct.
You're one of the very few who gets it right.
I could actually feel that because people don't pronounce my name correct either. So
Great.
I know that. Right.
So we are in the same boat and we know how it feels when we get the names right. Good.
Yes, honestly. So I'll just give you an introduction for everyone who's viewing again. We have a small introduction for Sir. So Dr. Sagar completed his graduation, BDS, from Dr. D.Y.Patil Dental College and Hospital, Mumbai, India, and he post-graduated, that is MDS, in
Prosthodontics. Yeah.
Prosthodontics, yes. Prosthodontics from Sri Dharamsala.
You can put it in short. S.D.M. Dharwad.
Okay.
Yeah.
S.D.M.
That will save your important precious time.
Okay. Perfect. Yeah, because we have a lot of questions lined up. Right. So that's from India. Again, also he finished his master's in oral implantology, that is in Atlanta, USA, a clinical mastership in oral implantology from State University of New York, Stony Brook University of Dental Medicine. Also finished post-graduation in restorative and aesthetic dentistry from the College of Dentistry, University of Manchester, that is United Kingdom. He is a recipient of numerous prestigious awards nationally and internationally, and has the honor to lecture, conduct courses and workshops globally. He is also a faculty member of various education bodies worldwide to his peers worldwide, thereby imparting quality education to his peers. He is an author of numerous publications and national and international journals, and has also written a book on A to Z of temporomandibular joint.
I'm proud of you.
God, thank you so much. And this is a lovely, lovely introduction that we've had. Honestly, really glad to have you, sir. So without wasting any time and jumping in right into the questions, let me start with one of the most basic questions, that what is the ideal age that a child should actually come to a dentist, to visit a dentist?
Okay. Now, because this is a non-dental forum where we are going to be addressing principally for all the kids and the parents who will be joining us.
Right.
So I will try to keep things as basic so that it's well understood and well interpreted. Okay.
Right.
So if you have to visit a dentist, you have to visit when you have teeth. So the first tooth which comes in a child, which is a milky dentition or milky teeth, generally is in around 6 months of age.
6 months, right.
So once you have the first permanent tooth coming in, that is an ideal time for a parent to bring in their small baby to a dentist. An ideal time. But how many of us actually follow things which are ideal? We are only bringing somebody when there is a problem.
True.
when there is pain, when there is infection, when there is trouble. So
Right.
all of this can be avoided if we follow some meticulous plans of
Right.
doing things before a problem comes in the first place.
Okay.
So the best way is, when your baby has teeth, make sure you find a nearby dentist. I wouldn't even say
Right.
who's very close, because if you want to have a good food at a good restaurant, that goes, people travel, right? So
Right.
similarly, find a good dentist,
Right.
somebody who is approachable, somebody who has good feedback from your people who have been visiting them, and make sure you
Right.
go and visit him, because the best advice which can be given for teeth is by a dentist. But many a times people refer to the new Bible called Google,
Yeah. Yeah.
try to self medicate, try to self evaluate. But being a doctor has taken considerable number of years and experience.
Absolutely.
So
Right.
let doctor do their job, let parents do their parenting. So once the teeth come, people who have specialized into the teeth, the oral cavity, they are the best ones to find out if everything is normal. And
True.
paying a visit to a dentist is nothing which is going to be more than just making sure that your baby's future oral health is taken care. As simple as that.
Right.
Because by the age of 2.5, 3 years, you will be having all of the milky teeth coming into place, maximum
Yeah.
by 3 years plus. So
Right.
that's the best way. That's the time you should be visiting a dentist, once the first tooth erupts, until you have all the milky teeth in place.
Right. So jumping on right into the next question, which is actually related to this one, is that how often should a child visit a dentist?
Okay, so we generally have a simple plan for everyone, where we
Right.
say that once every 6 months, you should have a dental consult or a dental visit. The
Right.
advantage of things happening once every 6 months is that anything which is going wrong can be arrested at the initial stage itself,
Right.
rather than it compounding to something big. And then you wonder, oh my God, dentistry is expensive. My dentist is charging a bomb. Well,
Right.
it's not the dentist who is charging a bomb, it's the neglect from the parent for their child or for the ward, which has made the stage become so aggressive or so advanced that it requires a comprehensive treatment. Or
True.
on the other hand, if you would have just visited a dentist once every 6 months, in spite of the child not saying of any complaint or any signs or any symptoms, it would have made things a lot more easier and streamlined. So the
Right.
advantage that gives is, we are addressing the problem at the initial stage and solving it at the initial stage itself before it blows out of proportion. Once every
Right.
6 months, it should be the answer.
Right. So this question actually just popped up in my head, and I would like to ask it that what is it possibly that when a child does not take care of its oral health can happen? What are the possibilities that it can lead to?
Very simple. We all have one life. Do you agree?
Yes. Yes.
Yes. We all have one brain, one heart. Everything is
Yeah.
one. So once we have it, we have it.
Right.
Luckily, teeth only comprise the entity which you have two sets in your entire lifetime. Which
Right.
means even if you don't maintain the first set, you still will have the second set which will come in. So God has given you two chances to maintain teeth.
Right.
Because God knows that anything and everything you do to the mouth is effectively going to contribute to your overall health.
Right.
Whatever you eat will give you the nourishment. But if your mouth is itself not healthy, the teeth are not healthy, there is some issue with the mouth or the oral hygiene or the oral health, the overall health is going to be affected.
Right.
So what we need to remember is, in a very simplified version, because the audience today is not dentists, right? We are
Right.
expecting a normal layman to understand in the simplest words. Now,
True.
if there is a cavity which is present, a normal term, which we call as caries, dental caries,
Okay.
that is effectively microorganisms or bacteria which are contaminating a good, nice, sound tooth structure.
Right.
When you are adding something which is going to get the pH levels towards acidic, which means anything which is contributing to dissolution of the tooth structure, the
Right.
destruction is very fast even before we can perceive it with our eyes. Just imagine an iceberg. you only see the tip of the iceberg, but inside the damage is exorbitant. So
Right.
what we need to understand and evaluate is that by the time the signs and symptoms start to come in, where the patient says, or the baby says, or the child says, or an infant says, because we have different stages. When we talk a
Right.
child, we are talking about different age groups. So by the time
Yes.
the complaint comes to us as a parent that my child is having some difficulty with the tooth, we have already gone beyond the stage, because
Right.
there is a basic difference which exists between a milky tooth and a permanent tooth.
True.
So the damage is a lot rapid when we have milky teeth compared to the permanent tooth. That
Right.
means the damage can be even more progressive at a very short interval of time.
Okay.
So the best way is making sure the child goes and visits a dentist once every 6 months, because
Once
we are
every six
able to address the issue at the initial stage itself before it blows out of proportion and the problem becomes huge. What
Right.
are the signs and symptoms that you were asking? If it's a baby, he won't be able to talk, but you can understand there is a mood swing because he will not be able to express pain.
True.
You and I would be knowing the difference between sensitivity and pain.
Yes.
A baby doesn't know anything. For him, everything, my tooth is hurting. Now,
Yeah.
what is that hurt? Now, that tooth to hurt, which means there is a nerve which is there inside our tooth for it
Right.
to get irritated, which means, again, that infection, irritation, the source of contamination has already penetrated the top layer, which is called the enamel.
Right.
Now, enamel is the hardest structure of the body,
Right.
entire body. That's the hardest structure.
Okay.
If something has penetrated the hardest structure of the body, you can imagine the amount of carelessness, negligence which would have gone in before
Right.
this stage occurs. So
Right.
the best way is prevention rather than cure, because when you cure, the baby might be cooperative, might not be cooperative.
True.
The experience of the baby, if the pain is severe, we might have to anesthetize. If we
Yes.
have to anesthetize, we have to inject. If we
Right.
have to inject, we are already creating mental scars in the patients. Who is a baby who will say that, doctor, I don't like the doctor.
Yes.
So then
Exactly.
he's always reluctant to visit a dentist. That's the
True.
mindset, because he feels a dentist is a devil.
Right.
So what are we doing? Ultimately, if we would have visited a dentist when there was no pain, no trouble, no infection, the appointment would have been smooth, both for the
Right.
patient and for the dentist as well. And effectively, we are building measures for the family as a whole to take care of their oral hygiene. Because if your mouth is healthy, your body is healthy.
Right.
As simple as that. So keep your mouth healthy, rest of the things will automatically be sorted.
So
I
coming on
hope
to,
I've answered that.
yes, you did wonderfully. So coming to my next question, which was actually related to your answer about the fact that children often they think of dentists as devil, and they do not prefer going to a dentist because they think of whatever they'll be hurt, they won't be comfortable. So how do you tackle that? Have you faced such problems? How is it that we can tackle that?
Okay. So first of all, let us stop blaming the children. There are a lot of adults who hate dentists. There are so many adults, mature adults, who are reluctant to
Right.
visit a dentist. Right?
Right.
So calling babies as culprits is, we are doing injustice to them.
Right.
Okay. Now this fear, now see, imagine a baby or a child or an infant who has absolutely no clue who is a dentist.
True.
Right? So it is upon a dentist, number one, to first make sure that the first visit is pleasant.
Right.
But even before he visits a dentist, it's the responsibility of the parents to first create an environment for the baby to know what is going to happen. Now, the babies today are very inquisitive, very intelligent. So they want to have a first-hand information of what is going to happen tomorrow. So
Right.
if we are able to customize, channelize, rationalize the child's mind that, you know what, we're going to meet a friend. That friend is a dentist friend. Now, many a times, if it's a female, they will say it's a dentist fairy. We don't have the luxury to be fairies. So we are just a friend. So they say you're going to meet a dentist friend. A dentist friend is going to be looking at you, looking at your teeth, and we'll be telling which teeth are good, which teeth are bad. So effectively, we are conditioning the baby, conditioning the infant, conditioning the child as to what is going to happen in an environment which is unknown. He's going to encounter a person who is unknown. Now, if we see a baby's reflex, whomever he doesn't know, he's not comfortable. If he's in an environment which is not familiar, he's reluctant to express himself.
True.
So we have to keep all of these things in mind. And the best way to do is first making sure your parents become effectively like your partners. You are telling the parent what is expected out of them before the child visits your practice. Then what is expected out of you as a dentist or a dental specialist in terms of being friendly with the child. Because you need to break the barrier first, create that trust, create that confidence. So effectively what I propose, that's what happened in our practice as well, is that in the first initial appointment, we don't do any dental work. We effectively take the patient around, has a tour of the entire premises because we have quite a big premises. So we take the patient around, make him familiar with the tools we use, make him familiar with the environment, familiar with the doctors. So he knows whom is he going to meet. He knows what is he going to encounter and what are the tools which are going to be used. Second time when the patient comes in, he's a lot less scared and a lot more receptive.
True.
That is the time where we introduce our work of at least checking the mouth, identifying what the problem is, letting him cooperate to take x-rays. Then we are breaking the ice. In my practice, even in the second appointment, we might not do any work, but we finish with the checkup part. So now we are doing an incremental approach. Stage 1, patient is familiar with the premises. Stage 2, patient knows the doctor is going to check my mouth. And even after checking the mouth, there was no pain. He did not cause me any trouble. So the conditioning is a lot more better. He's a lot more receptive for the treatment now. Then onwards, we have to really make sure the patient's coordination, cooperation is at a different level. So it's a staged approach. See, even if you put yourself in a dental chair, you're meeting, I hope you have been to a dentist and you're visiting a dentist every 6 months.
Definitely.
Very good. So even if you put yourself in a dental chair, what will you do? You are still scared that whatever the doctor does, it might hurt me. And everybody is scared of pain. Whatever is your pain threshold, but you're still scared of pain. So baby, infant, a child obviously is going to be scared. So we have to keep that in mind. So my advice is condition the baby first, because fear is something which can be because of unknown factors. So once we are introducing the concepts of familiarity, where the child knows, okay, what is going to happen next? The parents are helping in contributing in helping the child understand that this is going to be the sequence of events. He's the doctor. Doctor is somebody who has to really be like a friend to any patient, whatever age group. So once that comfort comes in, once that trust comes in, treatment will eventually follow. So spend time in getting the trust and the comfort first. Treatment can be done by anyone, but then we have so many dentists. We have so many professionals. Why some are good, why some are not good? It's not the skills. It's how you make the patient comfortable.
Right. Talking about comfort, actually, I had a point to add. My dentist used to. It's a very small point, but it's actually still till today. It's a point that's very sensitive to me. My dentist used to send me a happy birthday card on my birthday for a lot of years. So you know that bond that is created, and the bond that the dentist actually create with the child is marvelous. And I think parents can also do the same job when it comes to that, to condition them, to take them, to tell them before they actually go to a dentist. So
it's time for you to change your dentist now. Right? Now that you're talking to a dentist, and trust me, you will get a cake, not just a card. Okay, let's get back to our topic.
Now I'm going to think about that. Moving on to our next question. What is the best way to maintain a good oral hygiene?
Okay, so there are two ways of looking at that. One is the very common misnomer where people say that don't eat chocolates, don't eat sweets. Now, there are two organs which I always believe are at the highest risk considering we are in the 21st century. Teeth, because we have a lot of junk food which is available, which are good enough to spoil the teeth. And two, eyes, because we have exposure to everything, be it television, be it laptops, be it mobile phones, be it iPads, anything. So teeth and eyes can be most easily spoiled. But do we tell people not to watch TV?
No.
So can we tell people not to eat chocolates or anything sweet? Impossible. No. People will still eat. If I, as a dentist, I am somebody who loves sweets. So I cannot expect, because see, it is practice what you preach. So so I will not tell anybody that please don't eat chocolates, please don't eat sweets. Impossible, because your dentist loves that, and I myself eat it. And touch wood, I am doing decent dentally. So what I would suggest people is time yourself. Okay. Now, if you see the basic chart of what you eat and how you eat, you effectively need to avoid in between snacking. Okay. Now, there is a habit when we have small babies, there's something known as breastfeeding. Yes. Now, that breastfeeding many a times happens, say, in the middle of the night, late in the night, where effectively the baby sleeps off. Yes. Breastfed. Right. So effectively, the mouth has got a lot of contamination. The simplest form of exercise would be just to rub the mouth with water. So effectively, that acidic environment moves towards neutrality. For babies who become a little bigger, who actually start eating solid food, the basic idea is mother will always tend to feed something every half an hour, every 1 hour, every 2 hours. And the mouth, which needs time to move towards neutrality, is always in an acidic environment. Right. Now, if the baby, which is again difficult, for him to first convince him to brush, making a baby become convinced to brush is a task. And then expecting him to brush twice a day, that baby is definitely God sent. So it is almost impossible. So what we suggest are practical solutions. And the practical solution is what? Making sure you avoid this snacking. Okay. Whatever the baby wants to eat, I'm talking about baby means who's 7 years old, 8 years old, 10 years old. Yes. Yeah? I don't mean a baby who can't talk or who's only saying ow, that he's not into this category. Okay. Somebody who has solid food. Right. So for those individuals, the best way is to avoid in between snacking. Which means if he is having his breakfast, the next he will have is his lunch. Right. But make sure whatever he eats for breakfast, that's fine. Even if he has chocolate in breakfast, even if he has a small piece of sweet during lunch, perfectly fine, absolutely fine. Right. So there's no stoppage in terms of eating. You can eat everything, just maintain your oral hygiene. That's important. So what we as adults do, same thing, because we will have parents also who are equally responsible for their child and for themselves. And parents have to be role models. So as parents, you yourself should avoid in between snacking. Right. Whatever you want to eat, confine yourself to your breakfast, lunch, evening snacks, and dinner. Which can include sweets as well. No problem. But what is important to make sure is that your hygiene is maintained. That's why we always inculcate the habit of having your brushing done early in the morning, because your saliva is almost zero when you sleep. That's why when you wake up, the mouth is always dry. Yes. That's the first time you're supposed to brush your teeth, so that your mouth becomes more or less clean or germ-free. Right. Because in the environment, there's a lot of germs. Yes. Yes. And then at the end of the day, before you sleep, again you need to brush. So effectively, when the saliva has got a lot of antibodies, which means going to eliminate all of these bacteria. So for when that saliva level goes down, we want to make sure the activity of these microorganisms also is at the lowest. And that will happen when we as an individual are helping our oral cavity by removing everything properly. Same habits, if the adults or the parents are following, the child is very intelligent to pick it up. That
Right.
if my father or if my mother is doing brushing in the night, I also want to do
I
it.
should also.
Yes. And the brushing has to be actively done. It should be like an exercise, like an activity. All children are very excited to do with activities. So it should be like an activity. Come, let's join hands and do our
Yeah.
brushing session. So you have to make it
Yeah.
interactive and interesting. Same
True.
for in the morning. So when a child knows that there is something interesting coming up, he will look up to it, look forward to it, rather
True.
than go and brush. Whether he has brushed, number one. How good is the brushing, number two. Whether the brushing has gone on all the surfaces of all the teeth, number three. So we are anticipating, hoping he has brushed properly. But on the other hand, when we engage the child that let's do brushing, show me your teeth, you and I will have a comparison whose teeth are whiter, whose teeth are cleaner. So now child takes it as a competition, as an activity.
Right.
That's where the levels will start to go up, and you can see your child also reciprocating when the father and mother are actively doing that.
Right.
To make it interactive. Now there's this lockdown which is happening. So
Yeah.
all the children are having schools at home,
Hmm.
right? So what are the teachers doing? Trying to make it interactive so
Yeah.
that the child is listening to what is being told. Same thing we as parents have to do. Make it interactive for the child, for him to participate. Because
Right.
if we as parents understand that if our mouth is clean, we are eating food which is in a clean environment, not having pus, not having infection, not having
Right.
disease.
Right.
So whatever is being chewed in the mouth is not in a diseased environment, which is going to go inside the body. Otherwise, imagine, I'll give you a small example. Say I have a palm. There is a
Right.
pus which is present here. There
Okay.
is infection. Similarly, if teeth will have infection, there will be pus.
Yeah.
Effectively, what you swallow with saliva is what? With pus. Do you want to do that? No. And when you eat food, that is effectively going to be what? In a contaminated environment.
Right.
So the best way is to keep it clean.
Right.
You as an individual have to keep it clean. The dentist has to supplement you, but you have to be primarily responsible for your child as well.
True.
Make it an activity for the child. The child will love it. You will love it.
Right. So from this part, honestly, there are two things that I very clearly take back. One is that actually anticipating the fact that you are going to be chewing in a clean environment. It's such an important thing, and I don't think we've been seeing it with that aspect, or at least there's a whole new idea to it. That's the first thing. And
It's very simple. Now, why do you go to work? Because there's a dedicated place to work. Correct?
yes,
Now, you
yes,
are not playing in mud and sitting at your place to work. Do you
right,
agree? But why
yes,
does your work premises undergo cleaning every day? Maybe twice a day, four times a day. Why? Because you want to work in an environment which gives you
that is
peace
clean,
and comfort.
right,
Similarly, if the mouth is clean, whatever you are chewing in terms of the nourishment which is being derived, saliva which is coming in, everything will act in harmony. If
right,
there is already a diseased environment which is present, that harmony is imbalanced. If the
right,
disease environment increases, is exaggerated, the damage is on the higher side. So
true,
effectively, what I'm trying to say is, if the mouth is clean, whatever we eat, more importantly, the things which will go inside our oral
right,
cavity through the
yes,
digestive system will
yes,
pass through a clean channel.
hmm. True,
Effectively, what I'm trying to say is take your entire digestive tract like a water
clean,
pipe. Water
right,
pipe. You have
okay,
water coming in the pipes.
yeah.
If the pipe has got fungus anywhere, will you drink that water? Period. I rest my case.
This is the best explanation I have come across, firstly. And secondly, the fact that we should be involving the kids into an activity where they actually look forward to it. That's a very important point for parents to take back, because it's just get up, go brush your teeth. We're not going to. There's going to be no interaction. So I think those 2 points I especially am taking back. And because we spoke about sweets and we spoke about myths, there are two myths that I want to discuss with you, but I'll be taking a little detour for everyone who's joined in and who's joining in right now. Just to give a little information, uh, I'm sorry, we are talking to Dr. Sagar, and we're talking about being a dentist, and also to everyone who's coming. Just a little reminder that we have our Kids Okay Please memberships that are going to be coming, so to stay tuned for it. That's about it. So, coming to our myths that I was talking about, there are two myths I wanted to discuss with you. One is that eating a lot of sweets and eating a lot of sweets and chocolates can lead to a teeth, or can lead to spoiling your teeth. And it's a very common myth that parents stop their child from doing. So, what would you suggest on this?
Okay. Now that we are talking to a non-dental forum, let me give you a very simple example. Now, smoking is so common.
Right.
Smoking is so prevalent.
Yes.
So what is the first thing you should tell a smoker?
To quit smoking because of...
Exactly. To quit smoking because it can cause lung cancer.
Lung cancer, right.
Correct? Will he quit smoking?
Right.
Will he quit smoking? So what is the best way? Ask him to minimize first the number of cigarettes he smokes.
Okay.
For him to realize the importance of minimizing, first we need to make him understand the problems which can occur if he continues smoking.
True.
Similarly, keeping this example in mind, if you tell a child, stop sweets, don't eat sweets, quit chocolates, will he do that?
No.
No. Will you do that? No. Will I do that? No.
No.
So if I can't do it, you can't do it, how can you expect a child to do it?
Child to do it, absolutely.
So the best way is, as I told earlier, keep it to your meal time.
Right.
Child is walking on the road, I want sweets, okay, eat sweets.
Okay.
It's not supposed to be eaten at a time which is based on child's convenience.
Right.
Because whatever you eat is going to create an environment which is more favorable to destroy the teeth.
True.
I'll give you a very simple example again. Say, for example, there is a glass full of water, right?
Okay.
If I'm adding salt to it and I keep stirring, what's going to happen? It's going to become turbid. Water will become turbid water.
True.
Until we have some amount of salt which will start settling down.
Settling down, right.
Right? So we need time for it to settle down. Similarly, when we have our meals, for the bacteria to be neutralized by the good bacteria. Now there are good bacteria, bad bacteria. So
right.
for them to fight and neutralize the environment, which means from acidic, basic. I hope you're aware about this. There is acidity, neutrality, and basic, right?
Right.
So for whenever we eat anything, we are moving towards the acidic environment.
True.
For it to move towards neutral pH, it needs time.
Right.
That's why if you limit yourself to breaks, say I'm going to have my breakfast, then I will have my lunch. So I'm giving it time for it to move towards neutrality. But if in between I am popping in something, that reaction is halted. And again it moves towards acidity because we have eaten something.
Right.
Which means, again it needs to have time for it to move towards neutrality. Then it is lunchtime, again I will eat something. So what I'm doing, I'm not giving sufficient amount of time for acidic environment to move towards neutrality.
True.
So effectively, my mouth is always in an acidic environment. And if I have acidity, or people say I have acidity issues, what happens to their teeth? The teeth starts to wear off. Right. Because acid in simple terms is effectively going to wear out the teeth.
True.
And now the environment which we are creating because of frequent snacking, in between snacking, eating as and how I see something. I have seen people who come to us and they tell us, Doc, before we spoke to you, we used to walk, we used to see this put in the mouth. I said,
it's very common.
Very common, correct? So the first question I ask them is, do you have a child? They're even reluctant to answer this question because they know what is the next question coming up. So if I ask them, do you have a child? So the first thing they ask is, why are you asking? I said, What do you tell your child? Right? Not to eat sweets, not to eat that. What are you doing? What are you
True.
doing?
True.
You have to make sure you are limiting your eating habits to specific number of hours. Now, see, again, I'm not talking about people who are diabetic or those who have
Yeah.
any medical condition or they are medically compromised or have a comorbidity, etc. etc. We're not discussing about that. We're
Right.
talking about a child and a healthy parent. So for them, we need to limit things to the time which is meant for eating.
True.
Similarly, your entire digestive system also needs a break. You cannot keep overloading every 1 hour by eating something. Can you work 24 hours? No. You also need a break. You also
Yes.
need to unwind on weekends,
Yes.
right? Imagine your body parts also to be the same.
True.
You cannot eat and then go and sleep immediately. Now, that's again a misnomer. We're not discussing
Yeah.
about digestion in general.
Right.
Similarly, there are so many things which we have to take in mind because effectively every system needs to take rest.
True.
Similarly, your oral environment, the body who is going to act against the bad bacteria, also need a break.
True.
So limit yourself to what you eat to specific time zones. Breakfast, lunch, evening snack, dinner.
Right.
My personal advice is avoid fasting.
Okay.
Again, I'm not talking on religious sentiments, etc., etc. Avoid fasting.
Okay.
Eat healthy food. Again, I cannot say avoid junk food. That's impossible because the question will be, do I do that? No. I also love junk food. So limit yourself. Certain specific times in a week, I will eat junk.
Right.
That's it. You can have certain cheat days. So again,
Yeah.
you're not discussing nutrition. So
Right.
you can limit up to that, but keep yourself to specific meals per day, not in between snacking. That's what I would like to stress on.
Got it. So moving to our second myth that usually it's a very common myth again with children is that their parents avoid them to suck on their thumb because they think it can affect the teeth. Does that actually occur?
Okay. Do you suck on your thumb? No. I also don't. Which means it's not normal.
Right.
Correct? Right.
Right.
So effectively, anything which is not normal is going to have its deleterious effects.
True.
Right? Now, sucking on a thumb involves what? Involves muscles.
Yes.
Right? Now, when the child is growing, which means the teeth also are going to move.
Right.
Now, if you see your milky teeth are smaller, permanent teeth are bigger.
Bigger, yeah.
Milky teeth have gaps between them, permanent teeth don't have gap between them, ideally. So effectively, there is a difference. This difference is basically to create space for the permanent teeth to come in when the milky teeth go away.
Right.
That's the basic ideology. Now, when we are introducing a habit which is not normal, it becomes a habit. Sucking a thumb, putting your tongue like this. So it is called thumb sucking or tongue thrusting, like this. So people have these different habits. So effectively, what is happening? You are introducing artificial pressure.
Okay.
Like this, you are introducing pressure. There's a negative pressure in the mouth. You're sucking something. It's a negative pressure.
Right.
Similarly, when you are blowing something, you're effectively creating pressure. The pressure is from your cheeks, from your lips, from your tongue. Now, tongue is a muscle which is very active.
Yeah.
People say control your tongue. Why? Because it's a muscle. But people don't control their tongue. I hope you're getting it. Yes.
Yes, I'm getting it. Absolutely.
Yes. So similarly, tongue, when you thrust, you're effectively creating pressure on the front teeth. Okay. When you suck a thumb, you're creating pressure on the front teeth. So effectively, what you do is in these children, when you realize, when you look at the teeth, all of us will have teeth which are aligned.
Yeah.
Some people will have teeth which are jutting out.
Yeah.
So when you see like this, that's where you realize that there is a habit which is present. Okay. Now, this habit can be unconscious or conscious. Okay. Unconscious means child never realizes. The parent also never realized because parents were not paying attention that something is coming in.
Right.
Or it becomes conscious. Child is depressed. Child is lonely. Child is alone. He's sad. So there are so many contributing factors. But when you look at the teeth and you see there's a habit which is persisting, you need to break the habit. Right. So in dentistry, there is something known as habit breaking appliances. Okay. So effectively what we do is whatever is a habit, we break the habit. Okay. And then we treat the teeth. Okay. Because the jaw is going to develop. The
Right.
jaw is going to enlarge. And if the teeth continue to grow because of this habit and move haphazardly, the jaw is going to look okay, but the teeth are looking bad.
True.
So it's not a problem of the jaw. It becomes because of the problem. Now the teeth are in problem.
Right.
So I hope you're understanding. So again,
Yes.
treating the problem is very easy, but identifying the problem is very difficult.
Difficult. Right.
So that's why I told whether it is conscious or unconscious, we have to address that problem. Today we will tell the child, oh, don't do that. If it is unconscious, that finger will go back.
True.
So that is what we need to understand. If it is unconscious, child is depressed, child is sad, child is lonely. So we need to counsel the child. Because once the child is not lonely, he's not sad, he's breaking of that habit. That is where that thumb will stop going in the mouth.
Right.
Tongue thrusting will stop. So all of these. So there are a lot of things which need to be corrected. That's why I said once every 6 months, if you are visiting your dentist, lot of the problems can be solved. Lot of things can be corrected, provided the visit to a dentist is not at an extreme stage where the child is suffering.
Right.
Child is hale and hearty, still visit a dentist. So he knows that I need to see a dentist who is going to see me and my teeth.
Right. At an earlier stage. Which is
Always better. Prevention is better than cure.
Sure.
We always advise people to have a half-yearly checkup, full body checkup. Why do we say that? So things are detected at the initial stage before it becomes a full-blown disease for which you need to get treated.
True.
As simple as that.
True. So coming up to our last 2-3 questions, we'll take the last 3 questions. One is that what can be given to kids as an immediate relief when it comes to toothache?
Don't give anything. That's my advice. Don't give anything. See, now what happens is, I'll give you a very simple example.
Okay.
Now, even if I have to give an antibiotic to a child,
yeah,
or a painkiller to a child, I will be giving it based on my calculation, which is based on his weight.
Okay. Okay.
Which means whatever is from the market, I will not give him.
Right.
So number one is, if I have to calculate before giving it to a child, I have decent experience, I have decent knowledge, but still looking at the weight of the child, looking at the weight bracket which that child belongs to, what should be the average weight, what is the growth spurt, what is the development pattern, etc., etc. And I have to decide my dosage accordingly.
Okay.
Do you think self-medication is possible? Don't do that. Don't try this at home. That's the message. Visit a dentist, call up a dentist, he'll be more than happy to help you.
Right. So for
remember, there are no heroic awards for everything. Let few specialties manage their own work.
True, absolutely. So coming up to our next question, we spoke about how kids should be brushing at least twice a day. But are there any other tips you would like to give the parents, something that related to dentistry, related to oral health?
Okay, so my dear parents, remember you are role models, right? Keep your teeth clean. That's number one to the parents. If you start visiting a dentist every 6 months, you can just tag your child along. See, we are talking in COVID times today, so don't tag your child along this time. Let the situation improve. But make sure after that you tag your child along.
Right.
So the child will see, he is observing. See, always remember something known as modeling. So when a child is seeing how the dentist is treating his father or his mother, he knows what is anticipated, because that's the first-hand information which he can get. And if the dentist is telling you have 2 cavities, you have a missing tooth, 1 tooth has to be extracted, imagine the child. The child will feel, my father only has not taken care of his teeth.
Right.
My mother only is so lazy to work.
Right.
So see the mindset. So effectively, when he is coming in, some childs are very conscious. I don't want to have cavities. I don't want to do that. So they will make sure to keep their teeth clean, because they know they have to see a dentist in the next month.
Right.
Common example I'll give you is, whenever you have a dental appointment, swear on your heart and tell me, don't you brush properly that day?
2-3 days in advance, actually.
Common sense. Similarly, imagine now from the baby's perspective. He has to see the dentist the next month. So 1 month onwards, he will make sure everything is nice and sturdy.
Right.
That's the mindset. So when he is actually seeing his parents coming in, at home he is seeing the way the parents are taking care of their teeth, meticulously following the brushing, the flossing. Again, flossing is not for children, but they are seeing the parents are following flossing. They are using a mouthwash. They are sticking on to the time of when to eat, what to eat, how much to eat. It starts becoming a habit.
Habit. Yes.
See, why do we say that a child is effectively like a clay? The way we mold is how he's going to be. Same goes for his character, same goes for his behavior, same goes for his habits and values. So the way we mold ourselves, we are effectively becoming role models for our children. Now, whether we want to become good role models or otherwise, it's our choice. So parents, remember, the children is always looking up to you. So become good role models for them to be proud of you. And of course, when you have good teeth, the child will have good teeth. His children will have good teeth. So think about your grandchildren as well. Yeah.
I hope all the parents got this lovely message. And I think if we have any, I'm just going to the chat box once.
Yeah, please.
To see if we have any questions.
Because I can see some of my friends as well. Hi guys. I hope you all are doing well. I know this is a non-dental section where we are talking, but still, friendship always remains. So a big hello to everyone.
Same. Yeah, absolutely. Thank you for everyone for joining in. I think it was a lovely session. There are no questions in the chat box yet. I think everyone's pretty clear about what we spoke about. And
my friends will not have any doubts. They are from the same fraternity.
Even otherwise, even people who have logged in, I think it's really, and absolutely, I think it was a very informative session. It was lovely talking to you. Thank you so much for joining in. Thank you everyone for joining in. Stay tuned, stay safe, and we will keep you updated. Hope to have a conversation soon with you again.
Correct. Stay safe. That was the most important message. Take care. Nice to see you. Take care. Pleasure. Bye-bye.
Bye.